what are the chances that my acne medicine is going to work? That's a question that we're going to talk about today. I'm Dr. Arthur Kolsky. I'm coming to you today from my office, and there are some things that we learned this week that I'd like to bring to your attention. And we are a dermatology practice, as many of you know, that we specialize only in the treatment of acne. We don't do anything else. So we like to bring some of our experiences, like I'm doing today, to you, to acne sufferers, to try and give some educational value about what to expect with certain treatments and how acne treatment works in the real world. But remember, this is only for educational value. This is not meant to be medical advice. So I'm coming to you from my office today, and one of the things that we've seen this week, another thing that we've seen is the fact that some patients, they are trying to make the decision, what should I use? What should I use to treat my acne? And some of them have already gone to different doctors and they've gotten different medicines, and they come to see me because nothing's working. And they're not sure, why is that? I've tried this, I've tried that, I've tried everything and nothing's working, and what should I do? And so this is a common discussion that we have. And one of the things to understand is that not every medicine is going to be the one that's going to make you better. And it's not that it's a chance, it's not like you're rolling the dice. It's more that you need to look at the data. You need to understand what are the chances that this medicine really is going to work in the first place. And that information is readily available. You can go on the internet and you can look up the medication and you can look at the studies. You can look at what the studies show about this medicine's capability of healing all of your acne. And one place to look, you can go to the product inserts. So in each, for example, tube of cream, of prescription cream, there's an insert, there's a package insert that has all the information about that prescription medication. And it'll show the studies, it'll show a summary of the studies that were done by the companies making that medicine to get approval by the FDA to be used and prescribed as an acne treatment. And so that package insert will show you the information, it'll show you the data. And you can look and you can say, okay, well, in these studies, by using this medicine, it made these patients 50% better, 30% better, 60% better. You can look at that and you can get an idea. Is the medicine that I'm using going to give me a good chance? Now, of course, there's a bell curve in all of this. So some patients with the medicine, they can get all cleared up, all better. Other patients don't have any improvement whatsoever. But then you have the majority of patients that represent the data that show that the likelihood of what's going to happen is about this % better. And so you can look at that. And then you can say, well, the likelihood is that if I use this medicine, I'll get this % better. And it's a little bit more complicated than that, because in the studies, the patients are chosen very carefully to be all very similar in their presentation. So they all have the similar type of acne, the same numbers of breakouts, etc. Whereas in the real world, that's not the case. You have patients with very significant breakouts, patients with very mild breakouts, patients with mostly inflammatory pimples, others with comedones, which are the blackheads. So you have different types of acne patients, and that's not really how these studies were done. So you can't completely extrapolate the information that the studies are showing. But nevertheless, it gives you a pretty good idea about what to expect. And that can help you make a decision. Do I really want to use this medicine? Is this medicine going to be the thing that's going to make me better? Or do I need to focus on something else? Do I need to ask my doctor for something other than this? So those are important considerations. So keep that in mind when you receive a prescription for a particular medicine, or when you've heard about a medicine. Keep in mind that there are data, there is information that you can readily access that can give you insight into whether this medicine is really going to do the job for you, or whether you might want to ask your provider for something else.